Hi friends, once again welcome back to the Nurse channel. So you're watching the 11th series in our AIMS NORCET series. So this set of questions will not only will help you for the upcoming AIMS NORCET examination, but also for the SNO post which was notified few days back. So as like our old videos in the same series, we have 15 very important questions which were taken from your all nursing subjects, and we will have repeatedly asked questions, picture based questions and picture based explanations. So we assure you that the 30-35 minutes what we are watching will be benefited to you. So kindly watch the video till the end, and if you have any doubts or if you want any clarification regarding any points, you are free to ask. So before starting the video, I request to everyone who have not yet subscribed our channel, kindly subscribe our channel and kindly enable the bell button so that you will get notified when we are uploading the new videos. So straight away, without losing time, we will move on to the questions. So 11th series. So the 11th NORCET series. So we will start our session with a very interesting picture based question. So the first question is in the screen right now. You can see a picture of a ribbon in the screen now. So your task is to identify this symbol is associated with dash. So I have given a symbol. So you have to find out this symbol is associated with dash. So the options for you are option number A, AIDS, option number B, breast cancer, option number C, epilepsy, and option number D, suicide prevention. So this ribbon is associated with dash. And I can give you a clue, like all these disease conditions, all these options what I have given have symbols which are representing ribbons. Okay, so the color matters. So the answer for our question is option number C, that is epilepsy. Okay, so this is the International Epilepsy Day symbol which is observing on March 26. So purple ribbon is the symbol of International Epilepsy Day. Okay, this is the purple ribbon. Then other options. So you all know very well that there is a AIDS symbol. So this is a red ribbon, and World AIDS Day is celebrating on 1st December, and the red ribbon is the universal symbol of awareness and support for people living with HIV. Okay, so the next symbol is pink ribbon. So the pink ribbon symbolizes the breast cancer awareness. Okay, pink with the breast cancer awareness. And finally we have the orange ribbon. So orange ribbon meanings are often associated with gun violence prevention and suicide prevention. Okay, suicide and gun violence prevention, but these are also worn to show support for individuals who have leukemia, multiple sclerosis, spinal cancer or kidney cancers. Okay, so mainly this orange ribbon is meant for gun violence prevention and suicide prevention, and along with that for other some cancer conditions like leukemia, then spinal cancers, kidney cancers and multiple sclerosis. Okay, so so the first question, the four ribbons, its color codes and its significances. Okay, so I think you got the point. Now we can move on to the second question in the series. So the second question is, which of the following suggested for continuing education? So this is from the community health nursing. So which of the following committees, some committees I will give you. So which one suggested for continuing education? So the first one is the Mudaliar committee. The second one is the Chadha committee. The third one is the Kothari commission. And the final one is the Boer committee. So which among these suggested for continuing education? So the answer for this question is obviously option number C, that is a Kothari commission. So we will have a small explanations regarding these committees and commission. So first of all, the Kothari commission, it was the 6th commission in India which is happened post independence, but it was the first commission mandated to comprehensively deal with the education sector of India. Okay, so that is a Kothari commission. Then you know that Mudaliar committee. So Mudaliar committee, otherwise known as the Health Survey and Planning Committee. That's Health Survey and Planning Committee, and it is headed by Dr. A.L. Mudaliar. and was appointed to assess the performance in health sector. Okay, so that is regarding the Mudaliar committee. The next is the Chadda committee in 1964. It recommended the provision of one basic health worker per 10,000 population for vigilance operations through monthly home visits under the National Malaria Eradication Program. Okay, so malaria eradication program and multi-purpose workers, those things are recommendations of the Chadda committee in 1964. And the last option was regarding the Bohr committee. So the Bohr committee, it was set up by the government of India in 1943. So it was a health survey taken by a development committee to assess the health condition of India. So the development committee worked under Joseph William Bohr, who acted as the chairman of the committee. So Bohr committee 1943, health survey is the important term, and under the chairmanship of Joseph William Bohr. Okay, so that's all regarding the second question. So you are getting some information regarding the three committees and one commission. That's all. So now we can move on to the third question in our series. So the third question in the screen, 3 P's of principles of first aid include prevent further injuries, preserve life, and dash. So you should answer the 3 P's. In that, the 2 P's already have given in the question. So you should identify the third P in the first aid principles of first aid. So the options are option number A, provide comfort. Option number B, promote recovery. Option number C, position correctly. And option number D, prevent disaster. So the 3 P's of first aid management. What is the answer? So the answer for this question is option number B, that is promote recovery. Promote recovery. Okay, so the key guiding principles and purposes of first aid is often denoted by 3 P's. So the first one is the prevent further injuries, then second one is the preserve life, and the third one is the promote recovery. Okay, these are the 3 P's of principles of first aid management. Okay, so that's all regarding the third question from first aid. Then the fourth question. So in sterilization process, spore of which of the following organism is considered as control? Okay, so this is a repeatedly asking question. So the options for you are option number A, Bacillus subtilis, option number B, Clostridium botulinum, option number C, Bacillus stearothermophilus, and option number D, Aspergillus niger. So which is the control for sterilization process? So I think from the name itself you can identify the answer for this question. So option number C is the correct answer, Bacillus stearothermophilus. Okay, so stearothermophilus are used as the biological indicators for verifying exposure of a product to a sterilization process. For monitoring steam sterilization, endospores of Bacillus stearothermophilus are in current use, particularly for processes performed at 121 degrees Celsius or higher. Okay, so this is regarding the stearothermophilus bacillus. Okay, so the other options and their uses that we will have a small discussion. So Bacillus subtilis, it was another option. It can be used to induce resistance by inducing the synthesis of defense enzymes in the host. So this can be used to induce resistance. So Bacillus subtilis benefits include improved digestive health and IBS symptoms, immune system function, and lipid metabolism. So the beneficial effects of soil-based probiotics are not restricted to the digestive tract. Okay, so mainly this is used as a Bacillus subtilis is used as a thing to induce resistance. Okay, so that's all regarding Bacillus subtilis. Then another option was the Clostridium botulinum. So Clostridium botulinum, it is a bacterium that produces botulinum toxins under low oxygen conditions. So these botulinum toxins block the nerve functions and can lead to respiratory and muscular paralysis. Okay, so this is a little lethal. And regarding this botulinum indole, already we have discussed in our old videos also. Then another option was the Aspergillus niger. So it is a mold which is classified within the Nigri section of the Aspergillus genus, and it has been in use already for many decades to produce extracellular enzymes, that means the food enzymes and citric acid. So this is the use of Aspergillus niger. So it is a mold. Okay, so we are getting information regarding the 3 bacterium and a mold, and the use of these bacteriums and related to that. Okay, so next we will move on to the 5th question in our series. So the question is, in adults 1 unit of PRBC brings up hemoglobin levels by about dash gram per deciliter. So 1 unit of PRBC will increase hemoglobin by about dash gram per deciliter. This unit also is very, very important. So what is the answer? So options are option number A 10 gram per deciliter, option number B 5 gram per deciliter, option number C 1 gram per deciliter, and option number D 3 gram per deciliter. So what is the answer? So the answer for this question is option number C, that is 1 gram per deciliter. Okay, so that each unit of packed red blood cells, that is PRBC, is expected to raise the circulating hemoglobin by approximately 1 gram per deciliter or 10 gram per liter. Okay, 1 gram per deciliter or 10 gram per liter. So don't be confused with these things, simple mathematics. Then it is the PRBCs are used to replenish the volume and oxygen carrying capacity. So each unit is approximately 200 to 300 ml in volume. So every time we used to tell that 1 unit of blood. So how much is the 1 unit of blood? 1 unit of blood is nearly 200 to 300 ml in volume. Okay, so that's all regarding that question. I think you got the point. Now we can move on to the next question, that is the 6th question in the series. So from nursing education, and the question is, dash refers to emotional learning which results in formulation of attitudes. So emotional learning which results in the formulation of attitudes. So the options are option number A conative learning, option number B cognitive learning, option number C affective learning, and option number D concrete learning. So what is the answer? Emotional learning, formulation of attitudes. So option number C, affective learning, is the answer for the question. So what is affective learning? Affective learning is concerned with low learners, with how learners feel while they are learning, as well as with how learning experiences are internalized, so they can guide the learner's attitudes, opinions, and behavior in the future. So that is the affective learning. Affect means emotions. Okay, so we can remember like that. So that is affective learning. Then next options were like conation. So what is a conation? Conation is defined as the mental process that activates and or directs behavior and action. Okay, so cognitive learning is an active style of learning that focuses on helping you learn how to maximize your brain's potential. Okay, that is conative learning, maximizing your brain's potential. That is conation. Then another option was regarding the abstract learning. Abstract learning, or that means the acquiring the knowledge of general or intangible material, such as the meanings of the concepts and propositions and the logical and systematic relations between them. That is the abstract, in-depth learning. Okay, that is the abstract learning. Okay, so conative learning, cognitive learning, affective learning, abstract learning. Okay, so regarding these 4 terms, I think you got some information. So further information you can refer later. That's all regarding that question. Now we can move on to the 7th question in the series. So the question again from disaster management. So the question is, the collective term which is used for the techniques used to move a casualty from the initial location to the ambulance is called a dash. So what is a collective term for moving a casualty from the initial location to ambulance? That is the main thing. So the options for you are option number A, casualty lifting, option number B, rescue basket, option number C, evacuation, and option number D, relocation. So options are slightly confusing, but all these terms are very important in terms of disaster management. So my question is like, you have to move a casualty from the initial site of injury to the ambulance. So that is known as the evacuation, okay, not casualty lifting. So I will tell you the difference between these terms. So first of all, we will see what is an evacuation. So evacuation, it is also referred to as shelter out, okay, shelter out. So it is the response for when a fire, flood, or another type of disaster is about to occur, and it is safe to move people to a safer place outside of or away from the facility. So that is known as the evacuation. Then another option was the casualty lifting. So casualty lifting, it is the first step of casualty movement and an early aspect of emergency medical care. So it is the procedure which is used to put the patient or the casualty on a stretcher. So if you are keeping the patient from the area of this one to the structure, means that procedure is known as the casualty lifting. And if you are moving that patient from that site of disaster to an ambulance, then that is known as the evacuation. Then next comes the litter, otherwise known as the rescue basket. So what is a rescue basket? So a litter is a stretcher or basket which is designed to be used where there are obstacles to movement or other hazards. For example, in confined spaces or on slopes or in the wooden terrain, etc. So typically it is shaped to accommodate an adult in a face-up position, and it is used in search and rescue operations. Okay, so litter or the rescue basket is a substance, or it is a specially designed thing like a stretcher or a basket, and it will help the rescuers to move or take the victims out of the injury. Okay, so that is a litter or a rescue basket. Then finally is the relocation. So what is a relocation? So planned relocations may be used as a strategy to avoid future displacement. That means, for example, when areas are at highly disaster prone or too dangerous for the human habitation, when the impact of the climate changes are expected to make life unsustainable in particular areas, or when a return to original habitats is not possible. So like whenever there is a weather predictions, like there are chances of the flood and we need to relocate, we need to move the people from that affected from that area to a safer place. So that procedure is known as the relocation, and it is always, sometimes it will be planned. Okay, so that is a relocation. So you are getting information regarding the four very important terms in disaster management, and questions can be asked in any way. So that's all regarding that question. Now we can move on to the 8th question in our series. So the question is, premature closure of which of the following sutures can cause dolichocephaly? So how dolichocephaly is happening? Options are sagittal suture, option number B, coronal suture, option number C, metopic suture, and option number D, frontozygomatic suture. So premature closure of which among these following sutures can cause dolichocephaly? So what is dolichocephaly? How dolichocephaly head will look like? So those things I will be explaining now. So first we will see the answer for the question, that is a sagittal suture. Okay, sagittal suture. So you can see the picture of a dolichocephaly or a scaphocephalic baby. So here you can see the two photos. Okay, in both photos you can see the dolichocephaly where the diameter is increased. So the most common form of craniosynostosis is the premature closure of the sagittal suture, giving a scaphocephalic or boat-shaped or dolichocephalic head. Okay, so it is an abnormality of the skull shape which is characterized by and increased anteroposterior diameter. So you can see that anteroposterior diameter is increased. Okay, that means the increased anteroposterior dimensions of the skull. So this is dolichocephaly or scaphocephalic or boat-shaped skull. Okay, sagittal suture. Then you can have another picture. So you can see a normal head alignment, and in the brachycephaly how it is aligned. So premature closure of the coronal sutures leads to the brachycephaly. Okay, coronal suture leads to brachycephaly. So otherwise it is known as a short head. So brachycephaly is an infant skull deformity which is characterized by a lower than normal ratio of the skull's length to its width. Okay, length to lower than normal ratio of the skull's length to its width. Okay, so here we can see. So here it is reduced, brachy, it is reduced. Okay, so that is regarding the brachycephaly. So you are getting two important important points from this question. So we can move on to the 9th question in our series. So from oncology, which chemotherapeutic agents readily cross the blood-brain barrier? So which chemotherapeutic agent can readily cross the blood-brain barrier? So the options are option number A, methotrexate, option number B, carmustine, option number C, topotecan, and option number D, bleomycin. So what is the answer? Which among these can cause the blood-brain barrier? So the answer is option number B, that is carmustine. Carmustine is the answer. So we know that in the chemotherapeutic agents, this carmustine and lomustine are two of the most extensively used nitrosourea compounds. So this chemotherapeutic agents, there are so many classifications that we can refer later. So in that, one is the nitrosoureas, and their peculiarity is that these therapeutic agents are lipid soluble and therefore capable of crossing the blood-brain barrier. So these are lipid soluble, so that's why nitrosourea compounds can cross the blood-brain barrier, and examples are carmustine and lomustine. So the reason I have explained, but there are so many things that you have to learn from chemotherapeutic drugs that you can refer later. Okay, so that's all regarding that 9th question. Now we can move on to the 10th question. So which among the following may cause deafness in children? Which among the following may cause deafness in children? Options are option number A, meningococcal septicemia, option number B, maternal rubella, option number C, congenital syphilis, and option number D, trachoma. So among this, which can cause deafness in children? So the answer for the question is option number B, that is maternal rubella. Maternal rubella. So we will have a small discussion regarding this. So infection with the rubella virus during the pregnancy may cause fetal death or the multiple congenital fetal abnormalities that are known as the congenital rubella syndrome or CRS. So this is very important, congenital rubella syndrome, which includes fetal death or multiple congenital fetal abnormalities. Okay, so studies have demonstrated that congenital hearing loss or hearing impairment is the most frequent abnormality associated with intrauterine rubella infection. Okay, so here comes the answer for our question and its justification. So the other options we will see, the meningococcal septicemia, how it will be presented. So typically the first symptoms include fever, nausea, myalgia, headache, arthralgia, chills, diarrhea, stiff neck, and malaise. Okay, so later symptoms include septic shock, purpura, this is important, then hypotension, cyanosis, petechiae, seizures, anxiety, and multiple organ dysfunction syndrome. Okay, so these are the clinical manifestations in short regarding the meningococcal septicemia in children. Then another option was the congenital syphilis. So how it will be presented in children? So in children, the symptoms may include a rash, fever, an enlarged liver and spleen, and skeletal abnormalities. Okay, so enlarged liver and spleen, rash, fever, and skeletal abnormalities. So newborns will typically not develop a primary syphilitic chancre but may present with signs of secondary syphilis, that is generalized body rashes can be seen. So the primary syphilitic chancre will not be seen in newborns but can be presented with secondary syphilis features, like that is a generalized body rash. So regarding syphilis also you can learn later. Then another option was the trachoma. So trachoma, how it will be manifested in children is, most commonly children with active trachoma do not present with any symptoms, as the low grade irritation and ocular discharge is just accepted as normal. But further symptoms may include eye discharge, swollen eyelids, then trichiasis or misdirected eyelashes. Okay, what is trichiasis? It's a misdirected eyelashes. So these symptoms can be seen as the not as the initial symptom. Okay, so that is the manifestation of trachoma in children. Okay, so that's all regarding the 10th question. Now we will see the 11th question. So the question is, which among the following is not an essential fatty acids? So a question from nutrition and dietetics, which among the following is not an essential fatty acid? So the options are option number A, linoleic acid, option number B, stearic acid, option number C, linolenic acid, and option number D, arachidonic acid. So question is not an essential fatty acid. So the answer is option number B, that is stearic acid. Okay, stearic acid is the answer. So we know that only two fatty acids which are known to be essential for the humans are alpha linolenic acid, this is an omega-3 fatty acid, and linoleic acid, that is an omega-6 fatty acid. Okay, so these are the only two fatty acids which are known to be essential for human beings, alpha linoleic acid and alpha linolenic acid. Okay, so arachidonic acid, it is an essential fatty acid which is consumed in small amounts in our regular diet. Okay, so this is also essential but not as like the other two fatty acids. Okay, so here we have mentioned about the linolenic acid, linoleic acid, and the last one arachidonic acid. Then the another option was the stearic acid. So stearic acid, it is a saturated fatty acid with an 18 carbon chain. Okay, so what is the use of stearic acid? Stearic acid is mainly used in the production of detergents, soaps, and cosmetics such as shampoos and shaving cream products. It also helps objects such as bars of soap, candles, oil pastels, and hard candies to retain their shapes. Okay, so this is a use of stearic acid. So it is a saturated fatty acid. Okay, so we have explained about the saturated and the unsaturated essential fatty acids. Okay, so that's all regarding that question. Now we will see the 12th question in our series. So the question is, which among the following fluid is used as plasma expanders? So plasma expansion, okay, that is a key term in the question. So the options are option number A, crystalloids, option number B, colloids, option number C, both crystalloids and colloids, then option number D, normal saline. So which fluid is used as plasma expanders? So option number B, colloids, is the answer for the question. So we will have a small discussion regarding the crystalloids and the colloids. So first of all, colloidal solutions that we will see. Colloidal solutions or colloidal suspensions are nothing but a mixture in which the substances are regularly suspended in a fluid. So a colloid is a very tiny and small material that is spread out uniformly all through another substance. Okay, it is to spread uniformly all through another substance. Okay, so that is the crystalloid. So sorry, colloidal solutions. So colloidal solutions, unlike crystalloid solutions, remain intravascular. So colloidal solutions will remain intravascular. In other words, they remain in the bloodstream rather than entering into the cells. So this also means that they stay in our blood longer than crystalloid solutions. So colloid solutions can stay for a longer period than the crystalloid solutions. So for this reason, they are used as the plasma expanders as a form of fluid resuscitation in case of severe hypovolemic shock. Okay, so that is a colloid solution. So the reason I have explained why they are used as plasma expanders. Okay, so that's all regarding that question. Now we can see the 13th question in our series from genetics. So the question is, sex chromosomes are also called as dash. Sex chromosomes are also called as dash. Basic question. So the options are option number A, allosomes, option number B, homologous chromosomes, option number C, autosomes, and option number D, U chromosomes. So sex chromosomes are also called as dash. So the answer for this question is option number A, that is allosomes. Okay, allosomes. So we will have a small explanation regarding the autosomes and the allosomes. So first of all, we will see about the heterosomes, otherwise known as the allosome. It is a sex chromosome that differ in size, form and behavior from an autosome. So it is heterogeneous. Okay, otherwise that's why it is known as the heterosome. It is a sex hormone, that the sex chromosome that differs in the size, form and behavior. So humans have one pair of allosomes. Okay, so we have the 23rd pair. Yeah, that is a humans have one pair of allosome, or the sex chromosome. So these chromosomes contains genes that determine the biological sex of an organism, and along with that, these chromosomes form pairs. The X and the Y chromosomes pair together during meiosis, and this pair helps in the sex determination. Okay, so these are some important terms, important points regarding the heterosomes or allosomes. Okay, those are the sex chromosomes. Then now we will see what is an autosome. So autosomes, otherwise known as a U chromosomes, are the chromosomes apart from the sex chromosomes in a eukaryotic cell. Okay, so which all are not sex chromosome, that is considered to be as the autosomes. And in humans, the X and Y chromosomes are the sex chromosomes that we have already explained. All the chromosomes other than the sex chromosomes are called as the autosomes. Okay, so in short, we can understand like this. And there are 22 homologous pairs. Homologous, these are identical. Okay, 22 homologous pairs of autosomes in humans. Okay, 22 plus 1, total 23. So the 23rd pair is the allosome or the sex chromosome. Okay, so I think you understood this question. So that's all regarding the 13th question. Now we can see the second last question in our series. So from the ventilator care, question is, high PEEP is in ventilator is associated with which among the following complications? So here the question is asked regarding the complications which can happen if we are keeping very high PEEP on ventilator. So the options are option number A, hypotension, option number B, hypertension, option number C, hyperthermia, and option number D, hypothermia. So what is the answer? High PEEP in ventilator patients. So the answer for this question is option number A, that is hypotension. So how it happens, that I will be explaining now. So we know that what is a PEEP? PEEP means the positive end expiratory pressure. Okay, positive end expiratory pressure, and it is used to increase the oxygen delivery by preventing end expiratory alveolar collapse. We know that to prevent the atelectasis, we are keeping PEEP in the ventilator settings. So however, the associated increased intrathoracic pressure. So because of high PEEP, there will be increased intrathoracic pressure, and it can lead to an increase in the right atrial pressure. So increased intrathoracic pressure, that can result in the increased right atrial pressure, and as a result there will be decrease in the venous return. Okay, there will be a decrease in the venous return and further the cardiac output, and it can be manifested as the systemic hypotension. Okay, not hypertension, systemic hypotension, because of low venous return and low cardiac output because of the high PEEP. Okay, so that is the pathophysiology of how hypotension is happening in patients with high PEEP settings in the ventilator. Okay, so I think that is clear for you. Then what is a normal PEEP? So it depends upon the clinicians, and usually it will be like we can keep it like 5 centimeters of water and up to 10 centimeters of water we can see in patients depending upon the patient conditions. Okay, so that's all regarding that question. Now the screen you can see the last question in our series, the 15th question, and the question is, which of the following is an example of a primary source in a research study? So the question is from the nursing research, and it is regarding the primary source. Which of the following is an example of a primary source in a research study? So the options are option number A, journal articles, option number B, academic books, option number C, encyclopedias, and option number D, statistical data. So which is a primary source? So by the end of this question, you will be understanding what is a primary source, what is a secondary source, and its examples. Okay. So the answer for the question now is option number D, that is a statistical data. It is an example of primary source. So first of all, what is a primary source? So primary sources provide raw information and first-hand evidence. Okay, raw information and first-hand evidence. So the examples include interview transcripts, then statistical data and works of art. And a primary source gives direct access to the subject of the research. Okay, so that is a primary source and its examples like statistical data, works of art, interview transcripts, etc. Then what is a secondary source? Secondary sources provide a second-hand information, as the name indicates, a second-hand information and commentary from other researchers. Okay, so it is a commentary from the other researchers, and its examples include journal articles, reviews, then our academic books, etc. So a secondary source describes, interprets, or synthesizes primary sources. Okay, then so in short, a secondary source is anything that describes or interprets or evaluates or analyzes the information from the primary source. So the common examples already I have explained, like encyclopedias, textbooks that summarizes the information and ideas. Okay, so that's all regarding the primary source, secondary source, and its examples. Okay, so with that we are coming to the end of the 11th series of AIIMS NORCET series, and I believe that all these questions what we have explained today will aid you in preparing well for the AIIMS NORCET examination. So with that we are coming to the end of this session. So we will be coming with another set of questions very shortly. So till that time, thank you for watching. Bye.